workshop on the HHS mandate in public policy, and Katie Short will really be the facilitator of the discussion we'll have. But let me now tell you a little bit about Walter. I had the privilege of first meeting Walter. I used to read a little bit on the website about him, but I said, who is this guy? I had no clue who he was, but I liked what I was hearing. But I happened to be at a conference in Washington, D.C., put on by Avalon, and when I heard Walter speak, I was really moved. And I think part of the reason I was really moved is our crisis pregnancy center, I would say 90% of our clients come from the African American community. And as I heard Walter's story, and I just said, wow, I mean, he's so right in everything that he said. And I just thought, well, wow, it would really be great, you know, if our organization could find out somehow that we could really, you know, work with Walter and, you know, really help more than we do with the African American community. And I think Walter has really a phenomenal message for us. I wish I didn't have to make it so short, but maybe he can give us more about himself and his organization even tomorrow. But Walter is both president and founder of the Issues for Life Foundation and California Civil Rights Foundation. As a young man, Walter played football at Michigan State University. And the only reason I've got to tell you that is I was never a Michigan State University fan until my son graduated from there. I didn't even want him to go there, but you know, you can only do so much trying to channel your children to different colleges. But now I really am a Michigan State fan. So, and he got a master's degree in sociology in 1980. In 1983, he graduated from the United States International University, now Alliant International University, with a master's degree in business administration. He and his wife Lori were the recipients of the 4th Annual Walk for Life West Coast St. Gianna Mola Award for Courage Under Fire in the pro-life movement. The Family Research Council recognized Walter Hoye in 2009 with the John Wise Award. Walter works in the pro-life community, was honored by Chuck Colson, 2011 Martin Luther King Jr.'s Daybreak Point. And you know, this is probably the most significant thing that I see here. And he sounds like he's got a lot of the same passion my wife does, and he likes to go to jail. Walter was unjustly jailed for his peaceful defense of the unborn on a sidewalk outside of the abortion clinic in Oakland, California. He served as an incredible leader of the cause of the unborn despite the personal cost. His letter from the Santa Rita jail is now a classic. Of course, I want to see that one. And he still makes a little time for NFL, NBA, and I really was excited when he said the NHL, because that's my fun sport, and Major League Baseball. An author of the book Leadership from the Inside Out, Walter is in demand as a speaker and consultant. You know, I welcome Walter Hoye.
I want to just take a very few minutes, so let me get to the point. Today, right now, even as we speak, there is another conference going on, and it's going on in my community. Here, let me read you the announcement. The National Association of Black Journalists convened today, that was yesterday, in their annual Media Institute on Health. They're discussing health policy and health inequities in the African American community. The conference aims to provide journalists with tools to effectively report on the impact of healthcare policies and reform as they affect us, communities of color. Black Americans. Now, they have a speaker. Here she is. The U.S. Secretary of Health and Human Services, Cathrine, is speaking right now at a special briefing on health at the White House, and it's exclusively for the National Association of Black Journalists. Everyone is there. As we all know, Cathrine is President Obama's leading advocate for Obamacare and the HHS mandate in the Affordable Care Act. Now, I chose to be here on purpose. The President already knows how I feel about his Affordable Care Act. But there's a few things I'd like for you to know. And I only have a brief moment, so forgive me if I just run through it. Planned Parenthood, the culture of death, has a president. And the president a few years ago decided that he'd like to get involved in health care, and so you have Obamacare now. We have Obamacare now. But when he first launched it, he ran into some problems, some trouble. It was very difficult for him to get this up and running. And so you know what he did. He called a friend of mine in Los Angeles, Bishop Charles Blake. Bishop Charles Blake is the presiding president of the Church of God in Christ. And Bishop Blake delivered to President Barack Obama the entire Church of God in Christ denomination. Now, you got to understand the import of that. That gave Obamacare credibility, legitimacy. You see, Planned Parenthood has already been caught lying and stealing on videotape. And we still can't defund her. And I want to thank Lila Rose for that. She's done an incredible job with that. But that didn't do it. She's already been caught with her hand in the public treasury, even here in California. But that hasn't done it yet either. Kathleen, well, she just got finished shredding evidence on the Hill, and that hasn't been enough to defund Planned Parenthood or derail the culture of death or derail Obamacare. The only thing that keeps Obamacare up and running is this illegitimate credibility that she has of being a benevolent outreach to poor women. You see, it's important to win over communities of color. It's important to get communities of color involved. It's important to reach them. Because at the end of the day, the politicians are going to have a very difficult time voting our way when they continue to view Planned Parenthood and the culture of death and the HHS mandate, the Affordable Health Care Act, and Obamacare as some sort of kind and benevolent outreach to poor women. I want to share with you that I am grateful for the opportunity to come and speak and just be a presence. I've learned so much from everyone that has spoken, and I've learned so much from just really being in your presence. But if we're going to take on this giant and defeat the giant, it's going to take a team effort. You're going to have to get all of us involved. There's going to have to be room at the table for people that look like me to play and have room to run and to use the strategies that work in my neighborhood. I want you to know that, yes, it's true, we're the #1 client of Planned Parenthood. According to CDC now, it's 42 or 40.2% of all abortions are in my neighborhood alone. And to be quite frank with you, I don't have another 40 years to wait for something else to happen. Just to give you an idea of how critical it is, in 1966, do you know what our fertility rate was? 124.7. You know what it is now? Well, in 2003, it dropped down to 1.9.
Wow.
I don't have another 40 years. I'm not going to be around. So I want to thank everyone here for taking the time to participate. I want to thank you for being true to your faith. I want to thank you for taking the time. And I want to thank you personally. And then I'll quit. One of the reasons that I got on the battlefield was that I got a call from 2 friends of mine in the Catholic Church. They called me up, they caught me in my, I don't know how they caught me in my office, but they did. And they said, Walter, we're in front of an abortion clinic, and there are a lot of sisters, a lot of black folk going into the abortion clinic. There's men, women, boys, girls, and we're trying to reach them, but we're not having any success at it. And we're wondering if maybe a black pastor, preacher, minister, just somebody in the pulpit would just come out to the sidewalk and stand there. We think that if the women walk by their pastor, walk by their priest, it would be harder for them to walk into the clinic. Just your presence alone would save lives. So I said, okay. And I came. And sure enough, there was a stream of African American women, black American women, and men walking into the abortion clinic. Well, I don't have the time to go into all of it, but I can tell you that many of them recognized me as a preacher, someone in the pulpit. And it was harder for them to walk by me. And they wanted to stop and talk to me. And it got to the point where business was bad for the abortion clinic. I want you to know that the work that you're doing right now, the policies that you are forming, the fight that you have engaged in, it isn't simply about health care. I won't be here if you don't go to work. I'm not going to be around if you don't take a stand and embrace your faith and do everything you possibly can to stop this madness. So please, you have my heartfelt thanks. You have my commitment and my dedication to the cause. And if there's anything I can do to help anybody, call Dana.
Because he is very inspiring and motivating, and I just thank God that we have a leader like that, and not just in the African American community. I mean, for all of us. He really got me on fire about how much more we have to get engaged as a team together. So thank you so much, Walter. Now, Richard and Katie, if you could come up, please. And Katie, I'm going to turn the microphone over to you, and I will sit over there at the table. But that worksheet that you have, only comment I want to make about it, in the packet there, you will see legislation that we have in Michigan, and there was supposed to be another handout passed out to you with a Michigan House resolution that was sent to Congress, which is helpful. It's a resolution in support of the Fort Berry Blunt bill, and I'm just trying to encourage every state to do something like that where they possibly can. But we also have legislation that's actually in the works right now for conscience protection in the state of Michigan. You know, I don't know what will happen with that Michigan legislation. It's very broad legislation. In most cases where we have broad legislation, you know, we haven't got it through. You know, I'm praying and hoping they do. But I also have in that packet where there's a health care payer bill. That was really something that Christus Medicus put together in line with a lot of other people and came up with it. And there's a right of conscience group even in Washington that said, yeah, that's a, you know, that's probably, you know, one good approach, but, you know, nobody is seen to want to move forward yet in any state with legislation that parallels the Fortenberry-Blunt bill. And maybe that's because they just don't understand it. But we kind of want to use that model legislation for people outside California. But if you notice, you know, in that workshop, I do mention, you know, a balloting initiative as a possible opportunity here in the state of California. But that's why I want Katie, because she's local, she's been fighting the legal fight here, to kind of take over and facilitate this discussion. And would like to take about 20 to 25 minutes, and then we can all go back and get ready for the reception and dinner. Please, Katie.
I thank Walter for his talk there, because I have a feeling rather than a workshop, this should be called an altar call. What's going to happen next? We need people to stand up and start taking responsibilities for some of the areas that we've been talking about today, for doing some of these things, whether, say, an area of action or a geographical area. But that's what we're looking for now, is people who will step forward and say, yes, I'm willing to take this step, or I'm willing to follow up on this. And the first thing it was talking about with the Fortenberry bill, I think one of the first things is to talk about making sure that there is a very strong lobbying effort here in California targeting the particular congressmen who might be on the fence about it, or haven't stepped forward, who have been scared off. I was on a conference call on Wednesday that was discussing this issue, and I didn't really realize this. I was aware of the controversy that surrounded Rush Limbaugh's comments, but I didn't realize that it apparently split time in two into pre-Rush Limbaugh and post-Rush Limbaugh in terms of how much support that this bill was mustering. And unfortunately, I think the congressmen need to hear from their constituents that, no, that this has nothing to do with that. This has nothing to do with demeaning women, or the other side has very successfully turned this into a, are you for or against women issue? And they need to hear from people that, no, this is not about women, it's about religious freedom, and that we want you to support these, the Fortenberry Amendment, or excuse me, the Fortenberry Bill. And then in terms of, how many people here are not from California? Okay, I would say that's about a third. Because the problem is we have California and we have the rest of the country. In California, because of the situation with our legislature, our governor, all three branches of the government would be hostile to anything like this. We really have to talk in terms of any sort of major shift in terms of a ballot initiative. And maybe we're looking for people to sort of put together a committee to discuss what would be the best language to use for an initiative in California to restore religious freedom rights in healthcare. So is there anybody who would be willing to be part of that sort of effort? Okay. Yeah. I'm sorry, what your name, sir?
George Delgado.
George Delgado. Okay. We'll be hearing from tomorrow. Okay. So I appreciate that. Dr. Delgado is with the Culture of Life Services in San Diego, correct? Yes. So, because I think that is one of the few viable ways to address this issue in California as a legislative matter. Then the other thing that people can be doing, as we talked about, in your own community is, or within your own, if you're working with a Catholic hospital, or just, you know, I mean, either directly as an employee, or you have, I can't remember, privileges with a Catholic hospital, anything like that. What, as you said, find out what your hospital, what sort of services your hospital performing. Is it in compliance with the ethical and religious directives? And and there were several suggestions about how one could investigate those practices. I was noticing that when Walter talked about engaging people of color in this fight, and all of a sudden, that's one thing that struck me, is that what we have here in California is a substantial Hispanic population, and largely Catholic, and more pro-life than the general population. And so I think that that is something that has to be done, is reach out to the Hispanic community in all, you know, individually. And is there someone who would volunteer to be sort of a liaison with the Hispanic community on this issue? Sorry, I'm picking on one young woman.
No, I would be happy to.
Okay, I'm sorry, your name?
Rosa Escutia,
And where are you from?
Sacramento.
And are you a medical provider?
I am not, but I'm about to be married to one.
And what, okay. And I'm sorry, you started, somebody here started raising hand?
I'm happy to help with that. Laura Melendez.
And are you a healthcare provider?
I'm a nurse.
Nurse. Okay, and you know what, I find myself, I'm falling into exactly the language that I was excoriating in my talk about healthcare provider. A professional. Then one of the other issues that came up was we need to identify, excuse me, by the way, gentlemen, over there, please feel free to jump in at any point.
You're doing great.
Okay.
Where's the microphone?
There's one right at the table in front of you.
Mike? One right here, Mike.
Oh, there's one back there? Oh, he's right in front of me. It's typical of me. Well, you know, if you'll notice on here, you know, and I know Katie alluded to this, but it's really important to identify what current health plans cover. I think Bishop Basha, you know, made a very good point in this. And a lot of the coverage, you know, that we're talking about here has been in a way, you know, hidden, you know, in health plans. And sometimes, you know, you get certificates. Can you hear me all right back there? You know, you'll get certificates that says it's not covered, but all of the insurers have to file a plan, you know, with the state. And if you get copies of actually the plan design, you know, that they file with the state, that clearly shows you the coverage. And I don't know how, particularly in California, you would get around taking that out. It's been my typical experience, they would have to design a health plan specific for an organization that does not want that in. So I don't think they can remove it. But that's why this whole idea of identifying what's in the health plan is very, very important. And then another thing is, Richard Doerflinger alluded to, even the bishops, you know, they're in the process of looking at litigation. It's very important, you know, once the health plan is identified and you have a strong health plan that's consistent with Catholic teaching, that there's a litigation that takes place so that you can protect that health plan. Because as it's mentioned, come August 1st, any plans that are put in place after August 1st, and they make any changes whatsoever, they're going to have to be covering what's in, you know, the federal mandate now. So it's really important to get engaged in this. And I just wanted to ask again, Katie asked, but on the rest of the states, could we count on those people, an individual from each state, to work on, this legislation also? I know we got the Francis here from Ohio, and they're already doing the state of Ohio, but I know there's people from Arizona, Wisconsin. Can we look to some leadership here for the people that represent those states? Does anybody want to put their hand up and volunteer to do that?
North Carolina.
Or North Carolina. So does that mean we have a leader in North Carolina? Okay, great. And your
I'm
name?
trying to recruit local help. Patrice Adcock.
Patrice?
Patrice.
Okay. Patrice, I'd like to get your card afterwards. But if anybody else is interested in this, if they could approach me afterwards, because the Christus Medicus Foundation is coordinating different initiatives in different states. That's all I wanted to say.
Well, actually, getting back to that issue of the litigation, that's another thing we need is to identify potential plaintiffs to challenge the mandate. And, whether it's a Catholic institution which has already been in compliance with its Catholic teaching and has not been providing contraceptive coverage, and is going to be forced to do so. A Catholic college, a Catholic hospital, a Catholic entity. Particularly, we were looking for entities with over 50 employees because they're the ones who are going to be most squeezed by the mandate if it is upheld, because they're the ones who other entities will simply will face the moral quandary, but one that the law wouldn't exactly recognize, which is okay. You don't have to provide coverage for your employees at all unless they're under a state rule, which would probably be preempted. But anyway, if you have more than 50 employees, is provide this coverage, which covers these unethical things, or pay a fine. And so that's the sort of conflict that presents a justiciable issue for a court to look into. So if you could work on identifying plaintiffs, and if you find someone who you think would, an entity that you think would be, would want to challenge this. And actually, I met last week with representatives from one organization, and I was very edified by the comment of one of them. What he said at the end of the day was, we talked about all the pros and cons of being a plaintiff in this sort of lawsuit. And what he said was, at the end of the day, however this turns out, if we are forced to make some really hard choices about paying fines or complying or cutting loose our employees, that sort of thing, at least we could sleep at night knowing we tried everything. And I thought that was a very good way to approach it. This is another option that we have, is to directly challenge the mandate. I have to say, I happen to be, color me optimistic about those Supreme Court arguments. I'm hoping that this particular issue goes away, but I see that as an opportunity then for Catholic Healthcare to put its house in order before this comes up again. So I wouldn't rest at that point. On the other hand, I would just say, okay, we've got some breathing space here. And then I think that covers about. Oh, I'm sorry. Please go ahead.
Can I make another comment about the litigation? Because one of the kinds of plaintiffs that we're particularly interested, potential plaintiffs, we're especially interested in talking to, are organizations that offer a health plan, that issue a health plan, health systems that offer a health plan, or just those who offer health insurance that now does not include these objectionable services, because they're in a very special situation, because the only religious exemption there is for a religious employer, not for the company that may offer a health plan, but only for those who are sponsoring and purchasing it on behalf of their employees. And there's another set of plaintiffs that also do not qualify for an exemption generally, and that's educational institutions offering a student health plan. They're not relating to their students as employers either. So the best they can elevate themselves to is second-class status, the accommodation where their students all get these services, but from somebody other than them. obligations because the courts are the first thing they're going to do is have a lot of arguments in the administration about none of these people having standing to sue. And we have to have a wide variety of different kinds of plaintiffs so that some of them will be left standing after all of that works out. The other thing we're very interested in is those who are not affiliated with a church, who do not have an organization that is religious as such, but who run a company, a business, who employ people, employ more than 50 people, but who operate their health plan now in accord with their own religious and moral values, and therefore are not exempt under those standards either, because those folks have religious freedom as well. So anybody who falls in those categories, just let me know. I'll be happy to talk with you later. Thank you.
Yeah, I would second that. I'm glad you brought that up, Richard, that the non-religious, non-specifically religious mission employer, owns an insurance company, a construction company, whatever, but up to now has not had to provide those services. Those are harder and harder to come by, but would be extremely valuable as plaintiffs in this. Yes?
Yeah. Is there anybody else that wanted to ask us any questions regarding this? Yes.
I just might not get to see you at the end of the conference or miss you, but I want to make a note. Please use the Catholic Business Journal to solicit plaintiffs, because we definitely have people who fit that qualification, and we love. I mean, we've been talking about on air. We've had guests, including Mike, and so CatholicBusinessJournal.biz.
Karen, thank you.
Contact me.
And I do need to talk to you more about it. I mean, Karen's been trying to talk to me more about all this, and I think I keep cutting her short, because I said, wait till this conference is over. But we really would like to see how we can solicit more support for that. And if nobody else has any other questions, do you have any other comments?
Only that I was asked to remind people to turn in their evaluation forms on their way out, so if you could do that, we'd appreciate it. Oh,
Yeah, Alvin.
I think you have model legislation that you would like to be introduced in basically all the state legislatures in some way or other. Is that true?
Well, there is. I kind of focused, the Christus Medicus Foundation is really focused on trying to get, legislation that would be parallel to Fort Berry bill, Fort Berry Blunt bill, and that's in your packet. That's, and obviously every state's got to tweak it to fit theirs, but that just deals, primarily with, giving us an opportunity to control the gold, where we have an opportunity to spend the money on a culture of life health plan, and that, is a good model to begin from, and you can take that back to your states. And again, if any of the states would like any more support from us in explaining why that's so important, we'd be very happy to get involved. But then there is the Michigan legislation that is, broad legislation that's good. There's other organizations, American United for Life, they have some good model legislation, the Bioethics Defense Fund. So there's other people that can help in that. But we haven't been real successful with the broad legislation. So if there's no other questions, I just have a final remark. And both Richard and Bishop Basha talked about it today, and I think Bill Cox mentioned this whole idea of, we need to, improve on the messages to counter this, created myth that, we, all of us, we've got this war on women. And the reality is, this is not only a war, on our religious liberty, it's a war on the family, an attack on the family, big time, particularly our children. And that part of our messages has not been strong. I haven't heard much, talk about this. But that's a religious liberty issue, but, it's at the very core of our society. I mean, Obama, the administration, and everything that's being done, it's being done to take our kids away from us, our grandchildren away from us, and let the state totally control our children during that, that time that they're, just beginning their sexuality. And I know even as a parent of 7 children, You know, it's hard enough raising 7 children, you know, in this culture today. But I have seen from my work even in the crisis pregnancy centers, you know, many pro-life, daughters of pro-life people, daughters that are even very pro-life, you know, sometimes get caught where they, you know, don't know where to turn when they get pregnant. And because it's so easy to get an abortion. And these young ladies, they know what they're doing is wrong, but they do not want to hurt their parents. They do not want to embarrass their parents. So it's so important that we're able to be able to have places where our girls can go and not have it so accessible that they'll be able to take their social security number or whatever and just go to almost any place that will, you know, do abortion or provide medical services, and they will be able to get everything they want in that area without any parental involvement whatsoever. And that's what this mandate from HHS, you know, has done to us. So I think somehow we got to, you know, talk about that in our messages. Richard, did you want to say anything else? Well, listen, thank you all, you know, very much. Thank you, Kate.